UNCG School of Nursing Minerva's Mobile Health Unit has been on the road for 18 months. And during that time period, we have slowly filled up our calendar where we're 5 to 6 days a week on the road and seeing patients, sometimes 3 different locations in a day.
What is amazing about the mobile health unit is that we're in places that people don't expect us to be. It warms my heart that people can come and get access to care without having to worry about how they're viewed. And that's important to me.
What we get to see is that it's more than just healthcare. People need a lot more than just medications and prescriptions. They need people that are willing to care for them holistically, and we're able to address some of those things.
It really is just an incredible opportunity to serve our community and just meet people where they are. It's like the Forrest Gump, life is like a box of chocolates. You never know what your day is going to be on Minerva, but it is so fulfilling, and every day I walk away with some just incredible sense of accomplishment that I've really made a difference in someone's life.
We landed on the name of Minerva because of the symbolism of Minerva being a goddess of wisdom, but also of health.
We're actually educators that love patient care, that are incorporating our love of community, our love of care, and our love of education. It doesn't matter who you are, race, culture, class, we are here to help you, and we're bridge builders, and that's what I want people to know.
It's really been interesting how our consistent presence has really elicited trust and almost like a newfound hope. They know that there's someone out there that cares about them enough to show up consistently, and to me that's just incredible.
I would say the Minerva Mobile Health definitely has a team of people who are passionate about community, passionate about helping others, passionate about figuring out what we can do for people in our capacity. That's the team that we have on the Minerva Mobile Health Unit.
Working with Minerva has kind of helped me identify that there are care gaps, but I know that I'm making a difference and I'm able to help. So I want to continue working with Minerva, but most importantly, I want to make sure that I'm connecting with the community. I intend to continue getting more education, continue to be that resources for the people that I'm meeting out here in these communities that need us the most.